Good evening. I would like to welcome you to tonight's virtual program, Improving Outcomes in Skin Treatment Through Combination Therapies with Nautilus SWT, NDAG, and Frax 1550, Frax 1940. If you have questions during today's event, please enter them in the Q&A box, and we will answer as we go along. If you encounter any issues with the video or connection, please refresh your browser, as that will often fix minor issues. Google Chrome is the preferred browser. This didactic content is intended for global training and education purposes only. Candela Corporation and its affiliates make no representations regarding federal, state, local laws or regulations that might apply to use and operation of this device. For this reason, please review your country's current indication for use as provided by the respective regulatory agency. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professional. Individual healing times, discomfort, treatment results, and satisfaction can vary. Please discuss these as well as risks and benefits of this procedure with your qualified healthcare professional to determine whether this procedure is appropriate for you. With that, I'm very pleased to introduce our moderator and speaker for this event, Dr. Kanika Patel-Shalan, SVP of Clinical Operations and Medical Director at Candela, as well as owner of her clinical aesthetic practice based in Jacksonville, Florida.
Thanks very much, Grace, and good evening to everybody in Europe. We are very pleased to be here this evening with you, and we have two very special speakers and teachers joining us. Our first speaker is Dr. Cordula Anut-Frank, and Dr. Cordula is a consultant dermatologist. How are you? We're so happy to have you. And she is originally from Germany, but she's been living in Mallorca, Spain for a number of years now, since 2002. And so her clinic is in beautiful Mallorca. And she's going to share with us a lot of experience. And so feel free to ask questions in the chat, and we'll do our best to answer them. But you can see that she's very, very accomplished and also very experienced with the devices she's presenting. So really looking forward to her practice pearls this evening. And our next speaker is Professor Firaz Al-Niami, and Dr. Al-Niami is located in the UK. He is also a dermatologist. Many of you already know him, both Dr. Cordula and Dr. Firaz. Very prolific in his publications and his teaching, with many, many scientific papers and book chapters, and an excellent teacher. He's also a Mohs surgeon as well. And so looking very much forward to all the information that you're going to impart to us this evening as well in this section. Thank you both for joining. And without further ado, because really we're here to listen to you, I'm going to first just run through some general slides and also share some of our experience from our customers on Nautilus treating rosacea and telangiectasia with SWT, and also a small section on treating vascular malformations. I will invite those of you who are interested to please let us know. We had a wonderful in-depth masterclass on vascular malformations just a few weeks ago in the US, and I believe that is something that can be available as well, and so we'll be happy to share that. I do want to point out that this is a very, very special technology. This is not just your standard IPL. And it really is IPL reinvented, or IPL made even more laser-like, so to speak. SWT technology is selective wave technology. And essentially, it is the opposite of broadband. It is a narrowband technology. And that makes it safer. And let me explain why. There are a variety of handpieces, two that I'm going to speak about mainly, and that is the PR handpiece, which has a bottom filter cutoff at 530, and the VL handpiece, which has a bottom filter cutoff of 555. But the important thing is that both handpieces also have a top filter cutoff, and that top filter cutoff is cutting off higher wavelengths in the infrared spectrum particularly, that absorb water and create a lot of unnecessary bulk heating. You get plenty of necessary bulk heating with the wavelengths that are available in this narrowband technology, but cutting out that extra water absorption and bulk heating leads to a higher level of safety and more of a focused targeting of the chromophores with our applicators. You can see here at the top that the 530 applicator, for example, a large majority of its spectrum is around the 590 to 600 range, which is a very important range, as we know, for treating oxyhemoglobin. And as you progress over the spectrum, you also have the ability to hit the 755 range as well, where there is also additional oxyhemoglobin and deoxyhemoglobin absorption. So a variety of important absorption wavelengths are maintained in this selective wave band technology, where the extra higher wavelengths are filtered out by water. The other thing that makes this technology so very special is that it is totally unique. It is the only broadband light, or in this case, narrowband light selective wave that is under 1 millisecond, sub-millisecond technology. And that's very, very important to be able to deliver adequate amounts of energy with very, very short pulse durations when you are treating fine vascular issues. So the fine rosacea or a very, very light port wine stain that sometimes is difficult to clear will respond quite well because of the amount of energy that you can deliver to the tissue safely with a very, very short pulse duration. So those are the two major things that make this a very, very special device. So with clinical treatment, it's really all about choosing the correct handpiece, depending on what the issue is at hand. And you see on the left here, you have some rosacea that's actually fine vessels, but very, very dense, high in density. And you can choose either the PR530 or the VL555 to begin to treat this gentleman here. The PR530 would be my personal preference at lower energies because you have plenty of target chromophore because of its targeting towards the oxyhemoglobin. The PR530 is also very, very nice to use for linear telangiectasia. And we have lots of tricks and tips that we'll share with that. And when you're treating blue vessels, the Nd:YAG on the Nautilus is an excellent option. When we're choosing, once we've chosen our applicator, the next step is really choosing the pulse duration. And again, this is what becomes so important, is pulse duration is so very important when it comes to treatment of vascular lesions in particular. The larger the lesion, of course, the longer the pulse duration, and the smaller the lesion, the finer or the shorter, the faster the pulse duration. And that's why it's important to be able to deliver short pulse durations with adequate amounts of energy. The device is also capable of dividing the pulses to give the tissue some rest in between a given pulse, to divide the pulse into a split pulse, and that allows a more gentle delivery. Or you can choose to deliver all the energy in a single pulse, which gives you a more intensive delivery. And so these are just a few photos to share, or a few case examples. This one is courtesy of Dr. Troilus in Sweden. And this is the gentleman that you saw earlier. In this situation, she also chose the PR530, and she used a short pulse of 1.5 to 1.9 milliseconds. You'll note that that's a very short pulse, and the Nautilus SWT is the only intense pulse light device to go that short. She used those pulses at 7.9 joules per centimeter squared, which is also, if you are familiar with other technologies, much, much less energy than is required with other larger, longer, broader band technologies. And that makes the treatment overall much safer for patients because less energy is necessary in order to be able to heat the targets, given the type of technology this is and the short pulse durations that are able to be delivered. And you see the level of clearance here. This is a patient that is from Japan, from Dr. Suzuki. And this is also to illustrate that this particular device can be used on a wide range of skin types because of its ability to use a lower overall energy or lower overall fluence delivery to the tissue. because of its selective waveband technology. And in this case, Dr. Suzuki used the PR530 in the short pulse. I would imagine that he probably used a relatively short pulse, but you can treat this in multiple different ways, using it 1.5 milliseconds, even 3, 4, or 6 milliseconds, and then providing the energy so that you get the treatment endpoint that you want, which may be just a very, very soft blanching and blushing, a purpura that disappears. And you are able to create purpura easily with Nordless if so desired, but certainly very, very easy to control because of the versatility in the selection of pulse durations as well as fluences. This is another case from Dr. Simon in Spain. And in this case, the VL555 was used in a slightly darker skin type. In addition, he used the PL applicator, which has a shorter wavelength cutoff filter, and that is used for pigmented lesions. So you can see that pigmented lesion in the upper right lip that was taken off with the PL400, and the VL555 addressing the vascularity. In this patient from Dr. Gies in Germany, this was one single treatment with VL555 at 7 joules. So a very gentle treatment, in fact. You can notice, in addition, the improvement in skin texture, which patients often comment on. And I'm sure later on in the presentation, we'll talk about using the SWT applicators along with other modalities like 1940 and 1550 to further improve texture. In this patient, the linear telangiectasias are treated, in this case with VL555 at 7 joules. But my favorite is really using the PR530. And the trick is really, if you've got an Nordless, is to gauge the size of the telangiectasia. And those finer telangiectasia will be a shorter pulse duration, like 10 milliseconds. And they generally need between 9 and 10 joules, depending on the density of the target. A more medium-sized vessel, maybe a longer pulse duration, let's say around 13 milliseconds, with a similar amount of energy, 13 joules. And a thicker vessel, you should try with a longer pulse duration, 15 milliseconds, and begin at 13 joules, but you may need 14 or 15 joules. And that's a rule of thumb that works very, very well for Nordless with the telangiectatic treatments. This is another patient that was treated with 3 treatments of PR530. And another with 2 treatments with VL555. Both the telangiectasia on the nose as well as on the cheeks in this patient from Italy were well treated. And this is finally from Dr. Peter Bjerring in Denmark, who has an extensive experience with the device, facial telangiectasia with the VL555. And this is the mixture of, and sometimes we choose the VL before the PR. In some cases, when there's some extra pigmentation or when there's an awful lot of chromophore, then you may want to choose your first session with the VL. It's a more gentle treatment, and then subsequent sessions as the chromophore begins to clear and there's a bit less target than with the PR530. And then this is a wonderful treatment with blue vessels. And of course, just a reminder to make sure that intraocular shields are placed when treating close to the eyes. But the Nordless has a very nice ND-YAG, which is easy to set based on the size of the vessels. And in this particular case, the ND-YAG was used with a 3 millimeter spot and 290 joules at 45 milliseconds. Now, briefly, vascular malformations are much more complicated to treat because they are, can be a variety of different conditions. It's a bucket term for many different conditions. You can have a capillary malformation, venous malformations, or mixed malformations like AVM, as well as lymphatic malformations. Excuse me. It's important to appropriately diagnose these, and many times it's important to do that by ultrasound. The flow and the pressure of the lesion makes a difference in terms of ultimate outcome, as does the depth of the lesion and the complexity of the vessels. So it does become more complicated to treat. It also is important to know that there are multiple different treatment tools, different devices that can be used to treat a variety of vascular malformations. Of course, the V-beam 595 pulse dye laser is a mainstay for treatment of vascular malformations and very, very safe for its treatment, particularly with cryogen cooling. The SWT applicator, the PR as well as the VL can also be used and does a very nice job, in fact, with port wine stains, for example. But additionally, when the lesions become deeper, or when there's a venous component, it's helpful to bring in the 755 nanometer wavelength on the GentleMax or the 1064 nanometer wavelength, either on the Nordless or the GentleMax or the V-beam systems. So that is a much more complicated way to treat, but many different tools to treat a variety of vascular malformations. Let's talk about treating them, particularly with Nordless, with the SWT. The first thing is to assess the density of the chromophore and the color of the chromophore. So pinks and reds, we generally treat with the PR530. If there's a violaceous hue, then go towards a longer cutoff filter of VL555. There is a variety of techniques, but you can use a single pass technique, and this is something that is generally recommended to first just gently single pass to mild purpura. But in some cases, this is a technique that's been described that's a double pass technique with a first pass that has a longer pulse duration of 6 milliseconds with some low to mid-range fluences. And then that second pass can be a purpuric treatment. Now, the reason for that is that you do get some conversion to methemoglobin, which has an additional absorption and will also preheat the tissue. But be careful, because if there's a lot of density, then you don't want to go ahead and do this second pass, because if you've already seen an endpoint with a lot of deep purple or purpura, then it's important to just leave it at that first pass. The sessions can be certainly repeated, and the latest thinking is to even repeat them sooner than every 6 weeks once the tissue is healed. These are some cases that I'll share that are from some of our providers, our physicians in the field. This is Dr. Pedro Santos's case, and these are the parameters that he used in the first, second, and third session with the PR530. He did a double pass technique using 5.5 milliseconds as his pulse duration with 8 joules. And then each of these were then followed by a shorter pulse duration and a lower energy. But again, the treatment endpoint is very important here. The second case here also was done with the double pass technique, and he used V-beam first on the patient, and then treated the lip area with the Nordless ND-YAG. And then finally, this is a case that I just wanted to pull and illustrate because it's a patient from Thailand, and so a darker skin type that was treated very successfully with the SWT, with the VL555. And in this case, again, the longer the pulse duration, the more gentle the treatment. If you're able to get some very fine purpura with the longer pulse durations, that is sufficient for the initial treatments before you begin to shorten the pulse durations. And with that general overview, I want to turn it over to Dr. Cordula to talk about the face, the neck, the décolleté, and many different types of combinations to optimize those treatment areas.
Thank you so much, Konika. Thank you for the invitation today. I'm really happy to share some of my cases, and I love combining the devices we have from Candela, even with other injectables and other treatments. And I'm going to show you some of the cases how I do it. So what we have today, let me see. How can I? Yes, yeah. So I think we see a new trend in our patients. So everyone wants to look attractive and healthy today, regardless of age. So we treat very young patients, we treat very old patients. So there doesn't seem to be any age limit anymore. And our patients ask for natural results. So they don't accept any downtime. They don't want they don't want to look different. They don't want to look changed. They don't want to look spooky. And the downtime is something very important. So our patients really want to follow the normal daily activities, at least 2 days after the treatment. So our aim is always to realize that, to make them happy. All right. So when we have a patient who asks for skin rejuvenation, we have to analyze the face. So what do we analyze? It's not only the skin, but of course, being a dermatologist, the skin is something very important. And we see today a lot of actinic skin damage, especially in the older patients, let's say from the generation of the 50-year-olds up to the 80-year-olds. Some solar keratosis is something which is totally common and which we have to address in our treatment as well. So even though patients just come for aesthetic treatments, but we have to take care of their skin health too. Secondly, of course, what do we analyze? It's the pore size, it's the imperfections, it's the pigmentation, the skin tone, the texture, the glow. I'm going to show you later a really great device that gives us an instant glow on the face just within a couple of days. And then we assess, of course, the lines, the wrinkles, and the volume loss. As we all know, we lose a lot of volume in some of our fat compartments, especially in the cheeks, but not only there, also in other areas. And this is something we can easily address with injectables, for instance. So let me go on. So we have a big treasure chest, and I think this makes our profession so interesting every day. At least I feel like that. So I enjoy it every day because it's artwork in the end. Yeah. So we combine devices like the Nordlers, the Frax 1940, Frax 1550, the Pico Way, and of course we also have some ablative lasers. But today this is not the topic of the sessions. And we combine those with neuromodulators, with threads, with skin boosters, with collagen stimulators like Radius, for instance. And also we have a huge range of HA fillers to treat volume loss. And the better we personalize it and the better we make our plan and the analysis with the patients, the better are the outcomes and the more happy our patients will be. So if it comes to the lasers, I mean, we already got a great introduction to the SVT. It's a wonderful device which doesn't stand still in our clinic. So the PR 530 and VL are wonderful, really safe hand pieces to treat pigmentation and vascular lesions, as Konika already told us. And then we have the Frax 1940. This is a rather new handpiece, which is working superficially in the epidermis. And this gives our patients a really great epidermal glow. We use that to treat flat actinic keratosis as well. And we use it for drug delivery. I'm sure you're going to hear about this later on by my colleague. And the next one is Frax 1550. So this is a deeper non-ablative laser that helps us for dermal remodeling. Our main indications in the clinic are scars and stretch marks and acne, of course. So this is has become a standard in our acne treatment, but also we use it for skin rejuvenation. And then the Pico Resolve 1064, this is the Ferrari of our lasers, and we use that for skin rejuvenation. The great advantage of the Pico for me is that we can treat all skin types with it, and even in the summer months, we don't have to be so careful with the tone of the patient. Also, we treat a lot of men with it, so they love it because the downtime is short. Yeah, so that's a really wonderful device. And of course, then besides that, we have ablative lasers and anti-YAG, but that's not for today. So I would like to show you some of our cases. I usually follow a multi-layer approach. So we try to treat different or various problems in one session. This patient received PR treatment, so an SVT treatment, just with 2 passes. She's rather a darker skin type, so she had quite a strong reaction after that, but a really beautiful outcome. And we combined that with some hyaluronic acid treatment in her pre-jowls and mid-cheeks, and a subtle lip augmentation. So she wanted it super natural. You can see on the left side, we used really very little amount, and she looked so much rejuvenated and fresh that she really sent us lots of patients. So that's another lady. She's in her 60s. She received a combination treatment of the Frax 1940. So this is the one that really gives this epidermal glow, which you see within a couple of days. We used quite a conservative setting here, so with 10 joule and only 35% of coverage. You can go much higher here, as we learned. And this treatment was followed by the Pico Way, 1064 Resolve, with a rather lower setting with 1.7, because she's a lady that has a busy life. So I wanted to be a bit conservative and not to go too high in the first session. That's another lady who, as you can see on the left picture, she looks quite depressed. She looks tired. She has not only that her skin looks a bit dull and pigmented, but also if you look at her lower face, she really has a significant volume loss. She looks quite tense, a bit unhappy. And the aim of our treatment here was first to improve the texture of her skin, which we did with the SVT, so just with 1 pass. We treated her additionally with a neuromodulator on the full face. So what we call full face neuromodulator is always includes the forehead, around the eyes, and of course the lower part of the face. So the DAO, so the depressor angulioris, and the mentalis muscle, which helps us to relax the whole chin area to give her a more relaxed look. And in the second session, we then started with the SVT combined with the Frax 1550. And I forgot as well, she received some filler, as you can see on the lower face. You know, she has a lot of shadows, you know, on her chin. So we treated this as well, and we gave her a bit of a lip augmentation. And I think on the right side, she looked so much more relaxed, so much more happy. And this reflects actually as she feels, because she's a super active woman. So let's go to the décolletage. I think this is an area that we really have to look at a lot more, because we see so much damage on décolletés, and most women are not so much aware of it. They usually stop, you know, on the jawline to invest in their, you know, in their treatments. But I think the décolletage is as important as the face, not only because we find a lot of sun damage here, a lot of actinic keratosis, but also just to match better, you know, with the aging process of the face. So we have treated her in 2 sessions. First session was the SVT with the VL, just to be a bit more careful than on the face. I mean, the décolleté might react a lot more than the face usually, so people experience more redness, even swelling, sometimes some burning sensations. I mean, don't be afraid of that. This always goes away, but I think it's a good advice to start with the VL, especially when you have a lot of pigment, instead of using the PR And then the second treatment, you might use the PR or the VL again. So I personally love the VL for the décolletage. Be super careful, really, that you overlap your shots. Sometimes, I can see people look a bit like a zebra, have a zebra pattern. If I wasn't treating them well enough, so be careful with that. People are never happy about it, and it's sometimes quite difficult to correct. Yeah, so make sure you really do a crisscross technology, with 2 passes in this technique, so to cover the whole area. And in the second session, as you can see here, we combined the VL with the Frax 1940, and this is first the patients see a really nice glow of their skin. They absolutely love it. And secondly, the skin feels very, very smooth and really nice. So it's also a tactile experience that they have. All right, this is another lady. She wanted to be very natural. She would never allow me to use any fillers or no injectables. She's afraid of needles, so we had to treat her with lasers, which was, I think, a great option. So here in the first session, we combined the Pico Resolve 1064 for collagen stimulation, following by the Frax 1940. And in the second session, then we combined the PR 530 to reach more of the pigmentation, of the deeper pigmentation, again combined with the Pico. And on the neck, you can see she has quite a dyschromia, which we have treated with the PR. Yeah, and this is another case of actinic damage. This is really something I feel very, very close to, because we see this so often every single day. So solar keratosis are really our daily business, and we have to be aware of this of this health problem, of course, and what we try is not only treat the aesthetic part, but also the medical part. And in this case, this is an older lady, she's already 75. We treated her with VLPR in just 1 session, followed by the Frax 1940. Frax 1940 is an interesting device to treat very flat actinic keratosis, but it doesn't work for the hyperkeratotic keratosis. So then we need to use an ablative laser and like a CO2 fractional. And then we applied the PDT, an aminolevuline acid cream, on the actinic keratosis. You can see some of them on the cheek area, and sent the patients into the daylight for 2 hours. Additionally to this, we treated the neck with the VL. I'm going to show you the next picture, and that's the result of just 1 session after 10 days. And here we see the neck of this patient. So she was, you can see on the middle picture that she was really, really red just after 1 pass of VL. Don't be afraid of that. I had some sleepless nights in the beginning when I started with the Nautilus, but I must say all the results really turn out well. Just stay low with the energy, rather use the VL than the PR. If you see lots of pigmentation, then you're more on the safe side, and this will all disappear and will all go away. And as you can see here, the actinic keratosis, so these red patches here, they improved a lot with these sessions, but we had to do a second one to really clear them well. So this is another gentleman. He came to us with diffuse erythema. He suffered from acne. As you can see, he has a lot of acne scars, even from his teenager time. He's now in his 30s, and we only treated him with 1 session because he has quite a budget. So we had to choose something that we convinced him with. So we did a VL and a PR treatment for the diffuse erythema and the telangiectasia, which I think cleared them really nicely with just one session. And we started a PicoWay 1064 treatments to treat his scars. We followed this later with a CO2 ablative treatment for the deeper scars, but you can clearly see here after 4 weeks how the texture of the skin has improved, how the diffuse erythema has improved. So you can do a lot of these things with the combination. And that's also one of my favorite cases. This is a lady, she lived in Indonesia for many years. She's not a sunbather, but she had every day, she had some sun, even though she was using protection. So we treated her with one session of SVT, quite low settings with the VL and PR. And then the telangiectasia we treated with 10, we call it 10-10, as Konika explained already, so 10 milliseconds, 10 millijoule. That works really, really well for a middle size of telangiectasia. And then we combined this with some neuromodulator, especially on the forehead, but also on the chin area. And combined this with calcium hydroxyapatite, which is a neuromodulator, to give her a better definition in the jawline and also in the mandibular angle. And we also treated her neck with the same product in a hyperdiluted form. And this is the result after 10 days of this combination. Yes, and last but not least, this is my last case. She's she's in her 80s already, believe it or not, but she's still a business lady. She is a singer, so she has to look good, and she's has not much time for laser, so she prefers injectables. So for me, it's sometimes not easy to convince her that the laser is needed because she suffers from quite a lot of actinic damage. So in the first session, we treated her with Pico Resolve 1064. We had to be quite low in this setting, so only with 1.7 millijoule, because she couldn't afford a longer downtime than 24 hours, I'm sorry. And we combined that with HA on her mid-cheeks. And the second session we did after 3 months with the Frax 1940, and some of the pigments we treated with the PR7 Dual. And she received one suspension thread along her jawline. And you can see, and this is what I mean, what the Frax 1940 does, is it gives this fantastic glow, which really convinces the patients, and which they absolutely love. Okay, so in summary, our non-ablative laser technologies, they meet the needs of our patients. So I think this is where the future goes in most of the treatments. And we have a big variety of devices here from Candela that we use and that we combine. We personally favor the multi-layer approach and combine them in one treatment sessions. Don't be afraid of that. Yeah, it works really, really well. And let's always look at the health of the skin as well. So I think that's besides the aesthetic is a really important part for us doctors and dermatologists, because we are going to face, I think, more and more skin cancer and more pre-cancers, and we have to have a good answer for that. Okay, sorry, I can't. Sorry, I cannot see myself here anymore. Sorry, just gone the presentation. I'm very sorry, but I think this is the end of my presentation already, and I invite you to ask all your questions.
I have this was beautiful. Your results are gorgeous.
Sorry.
If you refresh your screen, maybe you can see it again. But really, really beautiful results. And there's a question from the audience that asks about when you put the Botox in and filler, do you do it in the same session as the laser, or do you tend to do it in separate sessions?
I tend to do it in the same session. So I usually start with the laser, and then I follow the Botox and the fillers. Yeah,
And
but usually in the same session.
In the same session. Lovely.
Yes.
Thank you, Dr. Cordula. And next up, we have Dr. Firaz.
Hi.
And we don't see you, or I don't see you. Yep, there you are. Very good.
I can see you. Can you hear me?
Yes.
Okay, right. Well, so good evening, everyone. Good afternoon if you are in the Americas. So my name is Firaz Alniami. I'm a dermatologist based in London. A fair bit of what I'm going to talk about has already been mentioned by my two colleagues, Dr. Shalin and Dr. Cordula. And they already introduced the device that I'm going to be talking about, which is the Frax 1940. Nevertheless, I'm going to dig in a bit deeper about why I think this is one of the great devices that is really pretty much becoming the workhorse of my practice. And more importantly, I will also share with you some data on how to combine that in terms of cosmeceuticals delivery. So fractional lasers have become very popular as a method of treatment. We had the botulinum toxins years ago, followed by the fillers, and then lasers came on board. But just over 10 years ago, the concept of fractional technology was introduced, and that really became the game changer, whether it's in rejuvenation, given the fact that we have shorter downtime, faster recovery, lower risk of complications. And within the fractional lasers, one of the first ones that became popular is the ablative fractional laser. But we have to remember that that comes with downtime. And not every patient necessarily seeks downtime or can afford to have the downtime. Now, on the other hand, we have the non-ablative fractional laser technology, which has the advantage of having a shorter downtime, but nevertheless, in many cases, when we talk about rejuvenation, as we will see, not necessarily inferior to the fractional ablative lasers. Now, when we talk about the non-ablative fractional lasers, we're typically looking at wavelengths between 1200 to 2000 nanometer, because these are the wavelengths that are absorbed by tissue water, but below the ablative threshold. So we are still talking about water as the main chromophore. But the Frax Pro, or the two fractional non-ablative handpieces from the Nautilus platform, which are the Frax 1550, so that number corresponds to the wavelength, 1550, and Frax 1940 will correspond to the wavelength of 1940, are really uniquely positioned in terms of the use of non-ablative fractional lasers for rejuvenation, scars, and a number of conditions. Now, there are two choices for you as a customer. You can either have these fractional handpieces as part of the Nautilus platform. So much of what was discussed by my previous colleagues in terms of the PR, the PL, IPL handpieces, the NDAG handpiece. So you can then add on the Frax handpieces to the Nautilus platform. But you can also have the option of having just the Frax handpieces as a standalone, as a device, which you can see on the right side of the image, which is called the Frax Pro. So to avoid any confusion, if we talk about Frax Pro, we're talking about a standalone device with the two non-ablative fractional handpieces. And this might be an option for those clinics who already have a Nautilus platform, but are so busy and want to have extra fractional non-ablative handpieces, but not necessarily an extra Nautilus platform, then they can have the Frax Pro standalone. Right, so we have two wavelengths, which are the 1550 and the 1940. Now, even though both of these wavelengths are between the range of 1200 nanometer and 2000 nanometer, and that is the optical range where you have good water absorption, but below the ablative threshold, their tissue interaction, so that is once the light being emitted from these fractional handpieces hits the skin, the tissue interaction is going to be very different. Now, because the water absorption is much higher as we reach 2000 nanometer, that means that the 1940 as a wavelength in comparison to the 1550 is much more highly absorbed by water, and therefore it's much more superficial. Now, some colleagues have a little bit of difficulty understanding this concept. The best way to explain that is that the skin is composed predominantly of water. So about 70% of the skin is made up of water. So as soon as the wavelength hits the skin, that's the 1940, because it's so avidly absorbed by tissue water, most of it is going to be absorbed as soon as it hits the skin. So there is little energy left to get in deeper. And this is why the 1940 is more superficially confined. Whereas the 1550, because it has less water absorption compared to the 1940, it penetrates deeper. And that is important because now we can tell that we can use the 1940 for more superficial resurfacing and the 1550 for deeper resurfacing or rejuvenation. So anytime you're thinking about the dermis, we're going to think about the 1550, but we often for too long have ignored the epidermis, with the exception of the full resurfacing with the full ablative lasers. The epidermis is important too, because that is the business card that we present ourselves with to others. It's the glow, the freshness, the tone, the texture, the evenness. So the 1940 can be described as an epidermal rejuvenating wavelength, but with the advantage of without having ablation. And looking at the histology is really compelling, because what you can see here, and this is histology data from work from Candela, looking at the differences in the tissue interaction between these two wavelengths. So where you can see 1550, Frax 1550, this is exactly what I meant because of its relative lower water absorption compared to the 1940. It gets deeper because not all of it will get absorbed as soon as it hits the surface of the skin. And you can see here in the image that it's getting really deep into the dermis. So this is a wavelength that is suitable for any dermal remodeling, stretch marks, acne scars, surgical scars. This is what you're going to be using. Whereas on the other hand, if you look at the histology of the Frax 1940, you can see that the injury is very superficial. It's very much the epidermis and that superficial part of the papillary dermis. So it's very much a superficial rejuvenation. So think about tone, texture, how smooth the skin surface is. You think about reflectivity of light, because when you have a smooth surface of the skin, the light is going to be reflected nicely, and this is going to be exactly giving us that glow that patients are usually getting from this treatment. Now, one of the great advantages of this particular fractional non-ablative handpiece, so both the 1940 and the 1550, is the ability to customize the scanner width without changing the handpiece. So you don't have to change the handpiece. The roller that you have that is attached at the end of the handpiece, that is just a guidance roller that you roll over the skin. But there is a scanner that you can dictate whether you want to go for a narrow scanner width that's of 4 millimeter or all the way up to 12 millimeter. Now, this is important. Why? Because let's imagine you have a narrow stretch mark or a narrow surgical scar. Then you don't need to use the 12 millimeter. In fact, you're going to waste energy and probably have inferior results. This is where you can customize the treatment and use a 4 millimeter scanner width, treat the individual stretch mark or the scar. And then if you want to blend in the treatment with the surrounding skin, you can then reduce the density and increase the scanner width. On the other hand, as you can see with the wider scanner width, the dots are further separated from each other, which means there's less bulk heating. That is something that also very suitable for the very high skin types when you don't want that intense treatments and bulk heating. So you can see that there are certainly advantages of having the ability to change the scanner width. And I do that routinely in my practice where I will change the scanner width based on the anatomic area. This video is going to just show you how precise this device is going to scan all these dots. So depending on the scanner width that you're going to choose, in the first case, you're going to see the 12 millimeter scanner width, but you can see how precise these dots are laid, and this is exactly what we mean by scanner. All you need to do is just hold the handpiece, divide it, and you're having good scanning of, and this is now the form. You can also dictate whether you want to go anterograde or retrograde. Right, so this is what the screen will look like when you, in this case, it's the 1940, so that's the Frax 1940, which is really one of my favorites. As explained earlier, it gives you really that glow. Anytime you think surface of the skin, anytime you think the epidermis needs some rehabilitation and rejuvenation, you will think about the Frax 1940. And you can see you can adjust your scanner width by simply just touching the touch screen. So you can go for a narrow to a wider scanner width. You can increase or decrease the fluence, likewise with the density. And what's also really nice about this device is that soft cooling is embedded within the device, so you don't need to have external cooling attached to it. There is cooling embedded. So depending on the thickness of the skin, depending on the density of the chromophore, depending on the desirable downtime or no downtime the patient wants, this is what you're going to be adjusting. You're going to adjust the scanner width, the fluence, and the density, and the number of passes. And ultimately, that will dictate your outcome. And as I mentioned, that will be dictated by the skin type, density of chromophore, and downtime. So this patient was one of my first patients who was treated with the Frax 1940. I was one of the first to have the Frax 1940, and I did nothing else. Of course, you can combine this with the IPL, you can combine it with many other treatments. I don't know why the slides are moving a bit faster than usual, but you can see she has this freshness, the glow, smooth surface of the skin. The pigmentation, because this is epidermal superficial pigment, that is going to be microscopically exfoliated by the skin. So it's not primarily there for the superficial pigment, but you get clearance of the superficial pigment as a bonus as you regenerate and renew the epidermis. So the entire epidermis is going to be renewed without the crusting and the oozing. You get smoothening of the surface of the skin, softening, even tone, decrease in superficial pigmentation for décolletés. That's great as well. Now, in this case, of course, you can add in the Pico Way if you want to combine. You can combine this with the VL handpiece, which is the IPL handpiece of the Nautilus. But in this case, these cases that I'm showing, it's purely just the Frax 1940. And I just wanted to demonstrate what actually this handpiece can do. So it can certainly be used on the face, but it also can be used for the chest and décolleté. Now, what I want to also briefly mention is a concept of this transdermal cosmeceutical delivery. And that is, in a simple way explaining it, if you put something on the skin, if you put a cream on the skin, then chances are that some of that is going to be absorbed, and most of it probably is just going to stay on the skin and not be absorbed. And that is because we have the stratum corneum and we have the epidermis and the skin barrier that is quite robust. But what happens is, you remember the histology that I showed you about the 1940, you get these superficial cracks in the epidermis that allows for these channels of delivery. So in essence, what happens is the epidermis becomes more permeable for molecules. And this is where we can take advantage from and then add in some of the cosmeceuticals immediately after treatment for enhanced absorption. So that means if you're looking at a patient with photo damage and you think this patient will benefit from a vitamin C serum or will benefit from non-cross-linked or low cross-linked hyaluronic acid, or in the case of pigmentation or even epidermal melasma, if you think, well, it will benefit from tranexamic acid serum, so this is ideal to combine with because you have the channels. This is something that is quite close to my heart, and I have published on laser-assisted drug delivery and cosmeceutical-assisted drug delivery. We can extrapolate data from a comparable wavelength of 1927. A few years ago, this was a study performed with one of the triple antioxidants. And this is what you see. You get dilatation of these microchannels immediately after treatments, and these dilated microchannels will allow for enhanced cosmeceutical delivery. In this case, with the triple antioxidant, it was found that 17 times higher absorption. What does that mean? That means if you put this serum on intact skin, some of it is going to be absorbed. But if you put it immediately after the Frax 1940 treatment, up to 17 times higher absorption. So you can see that if you want to inject like a boost of a serum of a cosmeceutical into the skin, it makes sense to pre-treat with the Frax 1940. So these are examples of patients who've had just a combination of Frax 1940 and just cosmeceutical delivery, where the skin is smoother, shinier, even tone, less pigment, in this case also melasma. That's something that I combine with tranexamic acid. These are all just a single session of, and in this case, you can see, if you look at the jawline, the pre-jaw sulcus, this patient actually consulted me for tightening treatment. And she had that tightening treatment, but at the same time, in the same session, she had the Frax 1940, and you can clearly see the smoothing of the skin. Now, the skin is more shiny, glowy, and it's nice, and that is because the stratum corneum is more smoother, the epidermis is softer and smoother, so you have better reflectivity of the light, and that better reflectivity of the light is going to be perceived as that smooth, glowy skin. You can also use it, as I mentioned, off the face, so you can use it on the décolleté, and you can use it certainly on the back of the hands. And this actually is being published by a German colleague of mine, Solver Lentigo. That's also being in combination with some cosmeceutical. This is a challenging scar on the knee. So these slightly raised hyperpigmented scars that typically in the past were very difficult to treat, but you can see barely visible the scar is flatter and the color has completely gone. And that is with a combination of the Frax 1940 and the cosmeceuticals with the tranexamic acid. In this case, this skin type 6 patient who had a combination of hyaluronidase and dilute steroids for the scar to flatten, and then the Frax 1940 with the tranexamic acid serum. Likewise, for lightening of the lips in some of the Asian population. So in conclusion, the Frax flow, so if we talk about the Frax flow, we'll talk about both wavelengths, the 1550, which is more for dermal remodeling, and the 1940, as I mentioned, is more superficial. The Frax 1940 is ideal for epidermal ablation, but at microscopic level. So you don't have the crusting using, so it's great for glow, tone, texture. But as I showed, you get these microscopic changes in the epidermis, so it's also great combined with some of the cosmeceuticals. There are no consumables. So really the way I explain it to patients is that the Frax 1940 really is finally an epidermal laser that treats the epidermis, but without the need for ablation. And with that, I'd like to thank you all, and I'll hand you over back to Dr. Shalin.
Thank you. That was wonderful. Lots of very interesting cases, and we're at the hour, but we have a few questions that I think would be great to answer. You mentioned it a little bit, Dr. Firas, about the difference between 1940 and 1550, but the question I think still remains to some that, what is the difference? Can they do the same thing with 1550, particularly in terms of the end result of cosmeceutical delivery as they can with 1940? Can you talk a little bit more about that?
Yeah, I mean, first of all, there is drug delivery and there is cosmeceutical delivery. If we took, so I was very careful in using the term cosmeceutical delivery, and that is because when we are using the Frax 1940, we really are up to 200 micron depth in terms of that permeability. Now, of course, that means there's still further molecules penetrating deeper, but that will going to be reserved if we are going to talk about drugs, for drugs that really need to be very superficial. Let's say actinic keratosis or even superficial basal cell carcinomas, if we're talking about drugs. But usually, typically from many of the other studies, when we talk about drug delivery, we need to get it a little bit deeper, and that's when we are talking more about the fractional ablative. So with the Frax 1940 is more suited for that superficial delivery of the molecules, and it's ideal to combine that with cosmeceuticals because of the synergism that we can expect with the 1940 in terms of epidermal renewal. Now with the 1550, the 1550 is really, even with the lowest fluence of the 1550, if you turn on the device and you go to the lowest fluence of the 1550, we're going to see that you are starting with 400 micron. 400 micron is very much in the dermis territory. So pretty much the entire epidermis and the papillary dermis is more or less, uninvolved. There are going to be some coagulation zones, but where you're really going to have the impact is in the mid to deep dermis, depending on the parameters you use. So with the 1550, you're not going to get the glow. You're not going to get the smoothness of the surface of the skin. You're not going to get that beautiful light reflectivity. And yes, you're going to get some edema. And if you apply some cosmeceuticals, maybe because of the edema, there is going to be some absorption, but certainly not to the same extent as the 1940, because with the 1940, the entire defensive system of the epidermis is just compromised histologically, so you have much more absorption. And you see that when you apply things, you can have that, you feel almost like a lot of it is just getting absorbed. So there are two different wavelengths. 1550 is really for your dermal remodeling. It doesn't do much for the epidermis. On the other hand, the Frax 1940 is predominantly the epidermis, not going to do much for the dermis. And if we're talking about cosmeceutical delivery, it's really the territory of Frax 1940.
Great. And for Dr. Cordula, when you do your vascular treatments and you combine them with a full face, say PR or VL, then you go back over and treat the telangiectasia, are you treating them separately, or are you first doing the full pass on the face with everything? In other words, do you do a second pass? Do you treat the 1010, 1313 in an area you've already treated before?
Well, it depends. It depends what chromophore we see. If we have a patient with a lot of pigmentation and vascular lesions, then I usually do a PR first with a double pulse, and treat the telangiectasia in the second pass. If it's the main chromophore, the hemoglobin, then I would start with the vascular first. Yeah, so it depends what is the main issue of the patient.
Wonderful. And of course it's judging that endpoint, right? If that the skin looks like it's quite red and quite edematous, then maybe on a different session.
Yes, of course. Yeah.
Yes. Wonderful. Well, I thank you both very much for such wonderful cases that you've shared and interesting insights. Many more questions, but I'm afraid we're just about out of time. So again, thank you this evening to everybody who's joined us on behalf of Candela as well, and to both of you. Have a good evening.
Thank you.
Thank you.